The criteria is anything less than 94% is a problem, but it could be anything between 92% to 94%. The vertical transmission rate for this COVID in pregnancy is not much. The baby is formed by 8 weeks. 5 to 8 weeks is the most important time. I'm catching up with my painting and books to read.
वेदा विनाशिनं नित्यं य एनमजमव्ययम् कथं स पुरुषः पार्थकं घातयति हन्तिकम् वासांसि जीर्णानि यथा विहाय नवानि गृह्णाति नरोपराणि तथा शरीराणि विहाय जीर्णानि अन्यानि संयाति नवानि देहि नैनं छिन्दन्ति शस्त्राणि नैनं दहति पावकः न चैनं क्लेदयन्त्यापो न शोषयति मारुतः अच्छेद्योऽयमदाह्योऽयमक्लेद्यो शोष्य एव च नित्यः सर्वगतस्थाणुरचलोऽयं सनातनः.
Today in COVID, where we are losing our elderly and dear ones, the danger of COVID is now engulfing those who are yet to be born. So, who could be better than an expert on fetal medicine, Dr. Poonam Tara, obstetrician at Max Sakib and Panchsheel. She worked over a decade in UK and acquired expertise in fetal medicine. Dr. Asha Joshi, a leading family physician in Hoskas, South Delhi, will be interviewing Dr. Poonam Tara. As a motherly figure, she handles a lot of female patients day in, day out. So, I hand over to Dr. Asha Joshi.
Thank you so much, Dr. Divakar, for your kind words and good introduction. I would like to ask Dr. Poonam, what are the implications on fetus if the mother becomes positive when she's pregnant, especially in the first trimester of pregnancy?
There have been lots of studies about the early pregnancy and COVID infection. And it has been found out that not much of problems actually happen, especially with respect to the miscarriages. Now, this is a Western data, but if you, in the newer Indian data, which is getting accumulated right now, there is a small risk of miscarriage, but the risk of miscarriages is not increased. Also, there is not much of an increased risk of any anomalies. If the patient is symptomatic and moderate to severe, then there was a presumption that maybe there was a growth restriction in the fetuses, which has not been proved, but it is a good idea to have an ultrasound done 2 weeks after the patient recovers from a COVID. Said if the patient is out of the hospital 2 weeks after the time that she's recovered, that would be, it takes 17 days for the COVID patient to become negative.
Then we can see the growth of the child within that period.
That's right.
What about if she's COVID positive in the third trimester?
So if she's COVID positive in third trimester, it again depends upon the severity of the problems, because the thing that we worry most is the hypoxemia. So if you're monitoring a patient at home and we are doing the regular things that we need to be doing, like the temperature and oxygen charting, and the patient is either asymptomatic or mildly symptomatic, then there is unlikely there's going to be a problem. It's going to be all right. Only in severe cases. Yeah.
Doctor, if the patient is in the third trimester and her oxygen level is between 92, 93, 91, something like that, does it affect the fetus?
The criteria is anything less than 94% is a problem, but it could be anything between 92% to 94%. Anything less than 92% is bad, but if it goes down to 90%, it's not good. 88% to 90% is what they would start thinking. So anything less than 94%, we should be, this is a warning symptom. This is a kind of a red flag. But if the respiratory rate is more than 24, if the fever is not coming down, if the patient is feeling breathless in spite of the diaphragm being up, patient should be in the hospital and need some oxygen and steroids thereafter.
When they deliver a child, then when do we start thinking how to examine that baby? Is the baby having any problem?
the vertical transmission rate for this in pregnancy is not much. So that when the baby is delivered, either by vaginal or cesarean section, and the studies have actually shown that vaginal delivery scores better in transmission than the cesarean section. So as compared to 5% rate of cesarean section, it's only 2% when the babies are delivered vaginally. Yes.
And doctor, after she delivers the baby, till she's feeding the baby, breastfeeding, she can't have a vaccination.
Definitely with the breastfeeding, you can vaccinate. There is no two opinions about it. As far as the pregnancy is concerned and vaccination, there have been lots and lots of studies now from the US, because what happened is that as the patients were pregnant and they were getting vaccinated, not knowing, a lot of data was getting accumulated. So, but that kind of a data is from the messenger RNA vaccine, the form of Pfizer vaccine or Moderna vaccine. So the data is very robust now, and it suggests that vaccination should be given to these patients who have had, there have been no anomalies reported or any other risks associated with the vaccine in pregnancy. The Royal College does not recommend it. It just says for very high-risk patients, vaccination should be given in pregnancy. And for us, when we are just giving Covaxin and Covishield, we don't have enough data. See, the number of medicines in pregnancy are limited. I mean, the medicines that we are talking about is what? Ivermectin, we're talking about remdesivir, the IL-6 antagonist. These are the few medicines which are given, and steroids, obviously. Out of these, the only medicine which is found to be of use is the steroids. Remdesivir is the one which is given only when there is certain issues. Not many complications are noted. The steroids again are given with the dexamethasone, which we know anyway we've been giving for lung maturity for 24 milligrams over a period of 2 days, which is what is given, and that doesn't have any problems. Followed by the methylprednisolone. So methylprednisolone again does not cross the placenta. Overall, it's not a problem only when the hypoxemia is there, only when the oxygen starts dropping. And that's the time when you start wondering whether you should deliver the baby. And then sometimes we have to deliver at 32 weeks. The baby is formed by 8 weeks. 5 to 8 weeks is the most important time.
It was very nice. It was nice talking to her, learnt a lot, asked her many, many questions.
No, thank you so much.
It was such a wonderful talk, and I hope it will be very useful to our viewers. I thank Dr. Asha Joshi for putting up excellent questions from our day-to-day practice, and Dr. Poonam Tara for excellent answers. I once again thank you both.